Hi, this is Scott Miller. Welcome to my Top Performance blog. Today I'm very pleased to be talking about the application of FIT in a residential treatment setting with the very talented and dedicated folks working at Prairie Ridge. Hi, guys.
Hi, Chad.
Would you just briefly introduce yourselves and say what it is you all do at Prairie Ridge?
Yeah, my name is Jenny Tart, and I'm an outpatient clinical supervisor.
My name is Jay Hansen. I'm the executive director.
And I'm Lori Young. I'm the clinical.
Perfect. And Prairie Ridge, what's its mission?
We are a provider of behavioral health care in an integrated setting. Our mission is to provide high-quality care to patients with co-occurring concerns. We focus primarily on patients with a primary substance use disorder.
And tell us just a bit about the people that you do see. Who are these people?
Really a cross-section. We're the only show in town, so we take pretty much all comers. We have had a history of serving the safety net population, but that is a mix, and we kind of, our facilities pretty much take in the cross-section of people in North Iowa.
And how many people are we talking about serving a year?
At any given point in time, we have approximately 400 active clients.
400 active clients, how many staff?
Part and full-time, with all of our staff, support staff included, we run about 70 staff members.
70 staff. And in the facility at any one time, you're saying that you would have 400 active clients?
Not in the facility, because some of our patients are outpatient.
Okay.
So at any given time, we'll have 37 to 40 residential patients, and then the rest would all be outpatient patients who will come and go in a variety of different levels of care.
And so some time ago, you all decided that you were going to try to implement feedback-informed work. Why? What was the impetus?
It was during the NITEX process when we ran into Bill Plum up in Duluth and brought him to NITEX, and we just felt like it made so much sense in 2005. And so we got some initial training with Bill Plum and implemented the forms, and we failed miserably.
You failed?
Yeah.
We did.
Can you say a little bit about why you think that was and what you mean by failure, I guess, to start off with?
We got reacquainted again a few years later. I think we just assumed we could learn about it, pick the evidence-based practice that was interesting to us, provide the training, and put the forms out there, and that somehow this was magically supposed to work. And what we've learned since is that this is about implementation science as much as it is about fit.
Okay, so it wasn't just as simple as going to a workshop, taking the forms back, asking the staff to do it.
Correct. And I think the other thing that became very clear to us is that we did not do a good job of identifying a clear rationale for our staff about why this was important. What would it do for them, and ultimately what would it do for the patients that they served? We needed to back up and identify the rationale for that. I think the other thing that was key for us is that we recognized that if this was going to happen, it had to happen at the management level, at the leadership level, and that if leadership wasn't on board and willing to drive this process with singular vision, it probably was going to fail the second time we tried it as well.
We conveniently blamed the staff first.
Yeah.
It was their
The other thing at the time that we were using the tools, we didn't have any reporting measures or ways to put data in and track outcomes. So we were collecting all this information and we didn't know what to do with it or how to track it or, like the rationale behind it. What is this really helping? So there was a lot of lack of clarity about how we were using the information that we were collecting.
So like learning any new skills, at the beginning it seems like most of us simply try to add it on to what we currently do.
Correct.
And what you're saying now is that somehow it's integrated into the very DNA from the top to the bottom.
It did. It had to be a genuine cultural shift, and it had to be driven from leadership. I think the other thing we realized is that training couldn't be a one-week workshop here or a day here, that it had to be an ongoing daily process built into supervision, built into our mission statement, built into every interaction that we had with all of our staff, not just our clinicians, but with all of our staff. It really had to become a common language and a way of life.
And so can you give us a picture about how it's integrated? Give me some ideas about the kinds of things you all do that puts FIT at the forefront of every interaction at Prairie Ridge.
I would tell you that that's a broad range. One of the things that we have done is we use FIT not just with our patients in individual and group settings, but we use FIT in our supervision. FIT has been built into our performance evaluations with our staff. FIT is a part of our staff interactions and expectation that feedback is something that you solicit and that you expect and that you respond to. It is something that we've trained our staff in everywhere from the receptionist who first answers the phone to our maintenance supervisor and his interactions with the patients that we serve, all the way down to the clinical work that we do.
I think one of the things, Scott, is that we had to determine that if we didn't deliberately practice this skill, we weren't going to get better at it. And so it was very important for us to put case reviews at periodic levels every other week, split up in teams, and send a message to our staff that this is important to us. We think this is a really good evidence-based practice, and if you're going to get better at it, you have to practice and get feedback.
Okay.
The other thing too, Scott, is our leadership team really had to model this for our staff too. So we had to practice it and show staff how to do that and be open to feedback. And so we're actively seeking feedback from them and being open to that and trying to adjust and make changes as best as we can. And then also teaching them how to do that with each other too, and always, referring them to each other in order to do that or to help that process.
Jenny, on that respect, can you give us an example of how management and leadership and supervisors are also seeking feedback?
Yeah, our supervision that we do with our clinicians, at the end of it, we're filling out the labs and we're asking, did we talk about what you wanted to talk about during your supervision today? How was your approach? So we're seeking feedback through our supervision and then making adjustments based on that. And we're tracking that on a week-to-week basis with the people that we supervise. It's just one example.
And so in addition to having management on board, it sounds like somehow you've managed to create an environment where this is actually safe to do. How did you do that?
I think we need to be really honest and say that wasn't easy. In the beginning of this process, I think, Scott, you advised us that this was a 7-year process, and we thought we were really advanced pupils, and it would take us that long. And we've been at it 5 years, and I would tell you that it's probably only been in the last year that I can say, honestly, I feel like there's been that shift in our culture. And so I think we've learned that patience is important, consistency, sticking to it. It required some change in personnel, bluntly. There were staff that they either weren't able or weren't willing to get aboard. And so we had to respectfully part ways with some of our staff. And so with new staff, they've been sort of enculturated into a FIT perspective and FIT language from the day that they walked in the door. We lay the groundwork in the interview. We say, we do things a little differently here, and we need you to be aware of that before you sign on to come and work here. The expectations are higher, and this is why. And this is what we mean by that. And so we try to lay the groundwork from day one. We've also prioritized time to solicit feedback. We do weekly huddles in all of our departments. And part of the huddle is identifying barriers and concerns in the environment, and then ideas in motion, strategies to make immediate change. And we believe that change has to be fluid in response to the feedback that we receive.
My goodness, this sounds expensive.
At some level, I would tell you that it is, but I think it's really important to understand really you can develop a really good business case around fit. And one of the things that has been really significant for us is we've been able to track services provided over the last 4 years. And our ability to provide services to patients, billable services that we're actually collecting money for, has doubled in the last 4 years since we started FIT.
Wait a minute. Would you say that again, Lori?
The billable services that we are providing has doubled in the last 4 years.
And you somehow see this as related to FIT.
Yes. Certainly we've made some other adjustments because of the environment that we've attempted to create, but we believe that FIT allows us to be more responsive to patient needs. As a result, they're more likely to continue to come to services. They're more likely to be satisfied with the service. They refer their friends to services here. Our staff are feeling more capable and more competent, and because of that, we don't really have to talk to them about direct service anymore. They manage that themselves.
We're doing an outcome study with the University of Iowa Research Consortium, and they sent their first year worth of customer satisfaction data. We read through it, and I kept thinking, well, the bad stuff must be in a section of its own at the end. But two things almost every client said: we feel listened to, we feel like we have a say in our treatment. And I think people are coming back because they feel listened to.
It's amazing. It's amazing to hear you say that, Jay, because, of course, that's what virtually all of the research says about psychological treatment, that it works. Clients say those two fundamental things, that I felt listened to and I had a hand in the services that I got. I got what I wanted, basically. So let me ask you, what has been the impact on the staff? So after you're over the hurdle and the hump, what's been the impact on the staff? What do you notice about them?
I think a mindfulness about entering into therapy. I think staff have a much greater ability to simply be with the person and try to figure out their preferences rather than I'm here to tell you about the knowledge that I have accumulated. I think it's really a newfound respect for the persons coming in, a respect from the standpoint that it's an honor for me to try to figure out how to understand you. And to do that, I have to listen to you. And I think that's a difference from, a few years ago when staff were viewed as experts, putting their wisdom out for patients to either take or not take.
Perfect.
Does that make sense?
Absolutely. And so if you were someone who were contemplating implementing FIT in a setting like yours, and I know it's a rich and diverse clinical setting, you have outpatient services, day treatment, you have residential treatment services, you do individual, you do groups, you have prescribers and regular physical health practitioners there, as well as social workers, drug out counselors, etc. If someone were thinking about implementing, what would the advice be?
I think the advice would be is to really focus on process, and that's a big part of implementation is training, obviously, and process. So realizing that there really are phases of implementation, that it's not just going to happen. And so we spent a lot of time training with our leadership team and coming back and training staff and then retraining, and we're still training 5 years later. And then it was important to have process in place and have somebody who is sort of like a change leader or somebody who can monitor that process, which is the role that I sort of stepped into as far as managing, how do we get scores in groups and how do we process that? How do we make sure the scores are getting entered into our, my outcome system? And so you have to have somebody with attention to detail on that and always keeping that a priority. And then again, just ongoing training, practicing of our case consults that we do weekly. It really takes that drive, and again, we're still learning something new, and we feel like we just get one thing and then we're still moving on to the next thing. So it's a process, and I think process is really key, and having staff on board with that is obviously really helpful too.
Perfect.
We also use, Scott, learning to fail well, and we really try to emphasize that with our staff, that it's okay to fail as long as you fail well, meaning that We come back and we identify what worked about this, what didn't work, what do we need to adjust, what do we need to adapt, what training do we need to engage in order to make sure that the next time that there's success. And I think because of that, our staff are less fearful to try new things and to put themselves out there because they know that that's part of the process, and our goal is that they're going to be better tomorrow than they were today and better next week than they are this week, and that there's never a point where we say you've arrived.
Right.
That we expect our clinicians to continue to grow even if they've been here 30 years.
And that has to be supported, Lori, by intentional, deliberate supports by managers and others. When people are risking, that is reframed into a strength, that you're taking the risk, you're going to be a better therapist. We're trying to say, if you come to Prairie Ridge, you're going to be taped, and we're going to use FIT, and you are going to be constantly improving when you're here.
It is what therapists say they value most, and it prevents them from having burnout, the sense of professional growth and development. You guys, I can't tell you how much I both appreciate having had the opportunity to work with you over these last 5 years, but also taking the time with me to introduce you to the readers of the blog. Is there anything that I haven't asked about that you really feel like I'd like to share this before we end here?
Not for me.
Just that this has been a process that we are extremely grateful for. There have been days we have not been as grateful for it because it's challenges. It has really revolutionized the work that we do. We don't believe that we have arrived. I hope we never believe that we have arrived. But we are definitely better than we were 5 years ago. And we firmly believe that becoming better at asking for and hearing and doing something with feedback in a meaningful way has been a key part of that.
I think we look, Scott, for an evidence-based practice that would reinforce and strengthen an existing client-based, client-centered culture. And I think if it's one thing I want to say before we quit is FIT fits into an obsession with meeting your client's needs perfectly. And that was a bias of ours, and so I think that's the reason we gravitated to it in the beginning.
Perfect. Jenny, Lori, and Jay, if someone wanted to get in touch with you, Prairie Ridge, tap your expertise, what number should they call?
They can call 641-424-2391. They also can contact us through our website at www.prairieridge.net. And we have had agencies come up recently and spend time with us, and we're very willing to take that time.
Perfect. Thanks so much, you guys, for taking the time with me today.
Thank you,
Scott.
All right, that was it.